pouch of Douglas is situated between uterus and rectum. All of the following muscles are posterior to right and left kidney except latissimus dorsi. So which muscles are posterior to right and left kidney? Psoas major, quadratus lumborum and transverse abdominis. The pancreatic bed does not include splenic artery. It includes left kidney, left renal vein and left crus of diaphragm. Splenic artery usually arises from celiac artery. Structures related to the lesser omentum are hepatic artery and portal vein. Posterior relationship of both kidney include the diaphragm, psoas major muscle and quadratus lumborum muscle. Fascia of Girota is renal fascia. The rectus sheath contain the following important structures except lymph vessels and ilioinguinal nerve. So rectus sheath contain which structure? Terminal branches of lower intercostal nerve and inferior epigastric artery. The superior mesenteric artery supplies the jejunum, appendix and ascending and transverse portion of the colon. Left gastroepiploic artery is a branch of splenic artery. Regarding trigone of the bladder, which is incorrect, mucous membrane has fold is incorrect. What is correct is bordered by interureteric crest, mesoderm in origin and overlies the median lobe of the prostate. Which is a flexor of the lumbar vertebral column? Rectus abdominis. The policeman of the abdomen is greater omentum. Xiphisternal junction is usually at the level of disc between the following thoracic vertebrae. None of these options. The attachment of the mesentery of the small gut is left transverse process of L2 to right sacroiliac joint. Which of the following statements are true concerning the rectus abdominis muscle? It is innervated by the lower 6 intercostal nerve. Embryonic ventral mesogastrium gives rise to lesser omentum. Urethra of female is shorter than in the male. Perineal body is formed by all except obturator internus muscle. It is formed by levator ani muscle, external anal sphincter muscle and bulbocavernous muscle. Which is true about superficial inguinal ring? It transmits ilioinguinal nerve. Duodenum is developed from foregut and midgut. Which is true regarding urethra? It originates from urogenital sinus and lined by transitional epithelium. What is true regarding ureter? It is anterior to genitofemoral nerve and anterior to internal iliac artery. The following is true of ureter. It crossed anteriorly by gonadal artery. The following is true regarding spleen. Nerve supply from celiac plexus. The inferior mesenteric artery supplies all of the following organ except the ascending colon. It supplies descending colon, transverse colon and sigmoid colon, but inferior mesenteric artery does not supply ascending colon. Below the level of the anterior superior iliac spine, which structure forms the posterior wall of the rectus sheath? None of these options. The hilus of the right kidney contains the following important structures: branches of the renal artery, renal pelvis, sympathetic nerve fibers and tributaries of the renal vein. All the following statements concerning the conjoint tendon are true except that it is continuous with the inguinal ligament. So what is true about conjoint tendon? It forms part of the posterior wall of the inguinal canal. It is formed by the fusion of the aponeurosis of the transversus abdominis and internal oblique muscle. It reinforces the superficial inguinal ring. It may bulge forward in a direct inguinal hernia. The following is false regarding rectus sheath. Deficient anterosuperiorly is false. What is true is it contains pyramidalis. Posterior wall is formed by transversalis fascia and inferior epigastric artery pierces postero-inferiorly. The following is not a content of broad ligament. Ovary is not a content of broad ligament. Round ligament, ovarian ligament and fallopian tube is a content of broad ligament. Which is not a tributary of left renal vein? First lumbar is not a tributary of left renal vein. Inferior phrenic, left gonadal and left suprarenal are the tributaries of renal vein. Internal pudendal artery in a female is a branch of internal iliac artery anterior. The following statement concerning the abdominal part of the sympathetic trunk are not true except that gray rami communicates are given of the lumbar spinal nerve. Motor supply to detrusor of the bladder is S2, S3, S4. Not true about part of duodenum is that it is derived from foregut. Uterine artery is a anterior branch of internal iliac. Following are constituent of spermatic cord except, so all are constituent of spermatic cord: vas deferens, testicular artery, pampiniform plexus, and genital branch of genitofemoral nerve. The content of the sacral canal are all except L4, L5 nerve root. So the content of sacral canal are phylum terminale, dura, and vertebral venous plexus. Length of female urethra is 4 cm. Lymphatics from the ovary drain into para-aortic node. Which is correct regarding tail of pancreas? Maximum number of islet of Langerhans. Main lymphatic drainage of the testis is pre and para-aortic lymph node. Parasympathetic fiber that passes through the vagus nerve supply the stomach and ileum. Superficial inguinal ring is an opening and aponeurosis of external oblique muscle of abdomen. Right testicular vein drains into inferior vena cava. Bile duct opens into the second part of duodenum. The functional unit of kidney is called nephron. Which of the following structure is not present in the transpyloric plane? Right suprarenal gland. So which structures are present at transpyloric plane? First lumbar vertebrae, tip of ninth costal cartilage, and fundus of gallbladder. All are true about superficial penile fascia except that it is innervated by ilioinguinal nerve. So what is true about superficial penile fascia? It contains dartos, it contains loose connective tissue, and it contains superficial dorsal vein. All are true about lymphatic drainage of uterine cornua and fundus except pelvic nodes. So lymphatic drainage of uterine cornua and fundus is to horizontal group of superficial inguinal node to para-aortic node and pre-aortic node. Inguinal canal is not bounded posteriorly by lacunar ligament. It is bounded by transversalis fascia, internal oblique, and conjoint tendon. Anal incontinence is not contributed by walls of house 10. It is contributed by anorectal junction, internal anal sphincter, and inferior rectal nerve. Cremasteric reflex is governed by L1. Following are true about portal vein except that it ascends behind second part of duodenum. So what is true about portal vein? It is formed behind neck of pancreas. Common bile duct is to right and anterior. Gastroduodenal artery is to left and anterior. Which structure lies in the intersigmoid recess? Left ureter. Regarding the left renal vein, what is false? Inferior mesenteric vein drains here is false. What is true is it receives left renal and left suprarenal vein. It drains into the inferior vena cava. Crosses in front of the aorta. Suprarenal gland gets blood supply from all of the following arteries except superior mesenteric artery. So suprarenal gland gets blood supply from aorta, renal artery, and inferior phrenic artery. Splenic artery supplies all of the following except liver. So splenic artery supplies spleen, pancreas, and stomach. All of the following statements of adrenal gland are true except both adrenal glands drain directly into inferior vena cava is false. What is true is both are supplied by three arteries. Right gland is pyramidal in shape and average weight is about 5 grams. Conjoint tendon is formed by lower fibers of internal oblique and transversus abdominis. Which organ has no end arterial supply? Lung. Liver, spleen, and kidney has end arterial supply. Glans penis drain into deep inguinal lymph node. Falciform ligament contains ligamentum teres. Deep circumflexal iliac artery is a branch of external iliac artery. True about appendix epiploica is it presents an alimentary canal along with mesentery. All are opening in prostatic urethra except bulbourethral gland. So which are the openings of prostatic urethra? Prostatic utricle, ejaculatory duct and prostatic duct. Deep inguinal ring contains round ligament of uterus. Lymphatic drainage of cervix is external iliac lymph node and obturator lymph node. Primary lymph node draining the lymphatic from the fundus of the stomach would include the pancreatic or splenic node. Consider the following statement: accessory spleens may occur at the tail of pancreas, hilum of spleen and its mesentery, and omentum and mesentery of small bowel. Cowper's gland open into penile urethra. Efferent of cremastric reflex are present in genitofemoral nerve. The blood supply to the uterus is by which artery? Uterine and ovarian. Which of the following is not a content of the pudendal canal? Nerve to obturator internus is not a content of pudendal canal. What are the contents? Pudendal nerve, internal pudendal artery and internal pudendal vein. True about inferior mesenteric artery, it takes part in formation of marginal artery. If a missile enters in the body just above the pubic ramus over through the anterior abdominal wall, it will most likely pierce which of the following structure? Urinary bladder. What is the nerve supply to the skin around the umbilicus? 10th thoracic ventral rami. Blood supply of the sigmoid colon is from marginal artery of Drummond and sigmoidal artery. Lesser sac of the stomach is bounded by posterior wall of stomach, under surface of liver and greater omentum. Iliac crest at the level of highest point of iliac crest is L4. After herniatomy, loss of sensation of the scrotum root of penis is due to injury of ilioinguinal nerve. All of the following are the posterior relationship of the kidney except psoas major. So posterior relation of kidney is quadratus lumborum, sympathetic chain and ilioinguinal nerve. The following provide maximum support to uterus: McEnroth's ligament. All are related to posterior surface of bladder except ureter. So which structure are related to posterior surface of bladder? Rectum through rectovesical pouch, seminal vesicles and vas deferens. Ventral mesogastrium derivatives include all except gastrosplenic ligament. So ventral mesogastrium derivative include falciform ligament, coronary ligament and lesser omentum. Branch of posterior division of internal iliac artery is superior gluteal artery. The bed of the stomach is not formed by splenic vein and tail of pancreas. It is formed by left kidney and left suprarenal gland. Ligation of the celiac artery mostly affects stomach and spleen. The venous drainage of liver into the inferior vena cava is through hepatic vein. A patient of external piles has pain. Which of the following nerve will carry this pain sensation? Pudendal nerve. The architecture of the liver is divided into lobes by bile duct, hepatic artery and portal vein. Lesser omentum has the following content except hepatic vein. It has the contents hepatic artery, portal vein and bile duct. Inferior mesenteric vein drains into splenic vein. True about foramen of Bogdeldak as posterolateral gap in diaphragm. Relation of caudate lobe of liver is anterior to right inferior phrenic artery. All the statements are true about ileum except large circular mucosal fold. So what is true about ileum? Lymph node and mesentery, 3 to 6 arcades in continuation and smaller diameter than jejunum. Rectus abdominis is inserted into xiphoid process. Pelvic splanchnic nerve is formed by anterior rami of S2, S3 and S4. The commonest site of surgical ureterovaginal fistula is below uterine artery in the McEnroth's ligament.